All right, hello everyone. All right, in this PowerPoint, I'm going to be talking about heat illness, um, and then I kind of branch off a little bit on energy drinks. Um, a lot of them kind of go hand in hand in terms of dehydration factors, and so somehow I threw it in when I made this PowerPoint. So you get a little bit of energy drink usage as it relates to heat illness towards the end of this PowerPoint. All right, so things we're talking about is hyponatremia, which doesn't happen too commonly here in Central California. Um, then we have exercise-associated cramps. Okay, not heat cramps. Um, I'll talk a little bit on like the myth of like heat cramps and stuff like that here a little bit. Then talk about heat syncope, heat exhaustion, heat stroke, and exertional sickling. All right, exertional sickling is also called sickle cell. It's a condition where under the exertional stress, the individual will go from this normal red blood cell to a sickle cell shaped. So both parents have to have this trait to pass it on. If one does and one doesn't, the individual can't get this sickle cell little thing. One issue with this is under this extreme stress, like heat stress, dehydration, asthma, illness, altitude stress, like pretty much just high altitudes. Not necessarily high altitudes like going up a plane, but high altitudes like I'm going to go to a whatever arena at a higher altitude and compete when there's lower air available, kind of thing. So that's when this red blood cell, this erythrocyte, changes to the sickle cell shaped. So when this happens, there's a decreased ability to transport oxygen. Also, all these like sickle cell red blood cells, erythrocytes, have a high chance of clotting. So this is where you have your strokes, heart issues, pain in different like muscle groups because there's blood clots going on. Okay. Often not, these people are immune to malaria. Okay. And the populations, I believe I have it in this. I do not. Populations are African Americans, not Europeans. Why am I drawing a blank right now? Middle Eastern, and there's one more I can't remember off the top of my head. Are usually the population that have this. Okay, so signs, symptoms. Okay, generalized muscle cramping, pain, usually in the lower extremity and back, some like where the bigger muscle groups are. Swelling because of the clots, weakness, fatigue, inability to catch one's breath because you can have clots in your lungs as well. So prevention. So athlete-wise, screening. So screening doesn't eliminate you from activities. It just, if you have this trait, and you're an athlete, they want to know that way they can keep appropriate measures. Is really all it is. And usually we go to like a 4-year college. Usually all the 4 years will test for it. Usually they'll screen everyone first, and that they have that they'll do like blood tests to see if you have it or not. And then with the sickle cell, they'll just monitor. Slow progression training with longer rests is really what's needed. Exclusion from performance tests, really in like the extreme conditions is what it is. And have oxygen available at trainings and high altitudes. That's a really big thing to help this person kind of recover. All right, next is hyponatremia. So like I said earlier, this is kind of a rare condition for here in the valley. So this is a low sodium level. Usually occurs when activity exceeds 4 hours. Okay, so this is your usually like your marathon, ultra marathon kind of individuals. There's 2 ways of really getting this. One is you ingest a ton of water without kind of ingesting any kind of sodium. So this is like you're just doing straight water, which isn't a bad thing. But you're not getting any other sodium through either like a sports drink or through diet. Okay, so you have this this water intoxication. Now this is really like a lot of water kind of thing. The next one is you sweat out so much sodium that you just throw your water sodium balance off. That way you just you may see these individuals with like a lot of like sodium lines on their face from this that's just salt. And then they still have a bunch of like water in them, and so it just kind of throws them off. So with this individual, they could be hydrated, dehydrated, or overhydrated. Okay. I think this is mainly on the East Coast kind of thing. Okay, so signs, symptoms. Okay. Core body temperature is less than 104 degrees. Okay, so pretty normal for most part. Core body temperature, just like a side note, can really exceed 104 degrees during activity. That's normal. Like when you're out there running, playing soccer, sports, whatever outside, it is pretty easily for your body to exceed 104 pretty easily. Just a side note, and we're talking about core body temperature, not take your temperature like under your tongue and your armpits, whatever. We're talking about kind of like the deep gut in your core kind of thing. I'll talk about more what that really is. Next, of nausea, vomiting, swelling in your hands and feet. Obviously, low blood sodium levels, progressive headache, confusion, mental compromise, so they could act differently. This is one of those you're probably not going to think that, oh, I'm hyponatremic. You don't really know what's going on. Okay, so this person's going to act really, really bizarre in a lot of different ways. Everyone's really unique on how they act. Okay, lethargic, so that's kind of weakness. Altered consciousness. Apathy, pulmonary edema, which really can't detect too much, cerebral edema, seizures, and coma. Okay, so treatment is if you happen to have a sodium analyzer, which is pretty expensive. Usually they have this only in hospitals. There is kind of like a handheld one that you can do. I just know it's really expensive. I've never actually seen one. Make sure you get this person to the ER. And this is kind of crazy because you give no fluids, which is kind of hard to believe, especially here in the Valley, because the first thing you want to do is give fluids. So again, you're not going to see this too often here in the Valley. More East Coast, they'll experience this. Everything's a little different. So this is, we'll see, okay, this is the normal levels without someone with, without hyponatremia. And then with hyponatremia, you see all the different water compared to the sodium. All right, next is exercise-associated cramps. Okay, so this is formerly known as heat cramps. But one issue is heat is not a factor here. So muscle cramps, this is usually single muscle or full body. Okay, the single muscle, most people have experienced like that calf cramp in the middle of the night. That's a single muscle cramp. Okay, where that gastrocnemius, your calf muscle, just kind of cramps up, pretty much screwing up your perfect sleep. Now, full body cramps is extremely painful. One of the most painful things I've witnessed, and I've seen probably a dozen of these so far, is where every single muscle in your body cramps. Not always at the same time, but pretty much back and forth. So usually this is kind of, the onset is during or after intense exercise. Acute, painful, involuntary muscle contractions. So the causes, a study, which I'm still trying to find the study because it just came out, is not dehydration. Dehydration does not cause this, and neither does heat. Okay, it can be electrolyte imbalance. Okay, the biggest one is going to be neuromuscular fatigue, or a combination of electrolyte imbalance and neuromuscular fatigue. Okay, so going back to full body cramps. So imagine that calf cramp, but everywhere. Okay. If you ever experience a back cramp and then your abs cramp at the same time, imagine your hamstrings cramp, so you straighten your leg, and then your quads cramp, so you want to bend your knee, and it's going back and forth. But that's everywhere. I've seen the jaw muscles up here cramp so hard I can see the striations in the muscle in the cheeks. Really, really painful. Really hard to kind of get that person kind of out of that kind of cramping loop. Now, the biggest thing with cramps, whether it's full body or single muscle, is calming the person down. Now, we're talking neuromuscular fatigue, which is the biggest thing. It's kind of like your nerves and muscles. They're just beyond the point of functioning properly. Usually that's where that intense exercise plays a factor. And and that's where they usually going to get this. So calming them down is a really big factor. Because usually when someone cramps, it's during game. It does happen in practice, but not as often as games. When the person is super excited. So calming them down is the best thing to do. Try and have them look at you. Hey, follow my breathing. Try and calm down best you can. I mean, they're still going to be pretty much hyperventilating in a way, but trying to calm them down will make a really, really big difference. Okay. So signs and symptoms. Okay, not dehydration. Could be thirst. Okay, because usually they're doing some kind of high intensity exercise, so they're going to be thirsty. They can be dehydrated, but that's not going to be like a sign or symptom of this. They'll be sweating, transient muscle cramps, fatigue. Treatment can give them a shitty area, stop activity, mild stretch, calm them down for the most part. Okay, this is your biggest thing. I mean, obviously, give them fluids because they'll be thirsty. That could help just kind of with their mental status, kind of bringing them down. So the study that I mentioned previously, which if I find it, I will absolutely attach in here because I witnessed the author present all this, and it was fascinating. It's funny at the same time, but he's pretty much a mad scientist in every way possible. So his athletic training cohort group, all his students, were his test subjects for all this. Okay, so to study this, he first took all his 15 or 20 students, and he put some electrodes on their calf, and he shocked them. I mean, all this is within all that, follows all ethical protocols and everything else. So he shocked them until they cramped, and that was their baseline. Okay, so let's say it took 100 shocks to cramp your calf. Okay, so you're sitting there just getting shocked until you cramped. Okay, and then he put you in a dehydrated state, okay, safely, and ethically. And then he shocked you again until you cramped. And there was no change in that amount per person. I see him, you put them in hot environments and he shocked them. No change. So this is the kind of stuff that he did to kind of prove some of this and kind of dismiss a lot of the different myths. So I'll talk about some of his myths and his research that he did kind of throughout this presentation. Also, he found that when you start to cramp, you're going to cramp for the next hour no matter what you do. All right, next is heat syncope. Okay, this is also known as orthostatic dizziness. Okay, it occurs when a person is exposed to high temperatures, attributed to peripheral vasodilation, okay, postural pooling of blood, diminished venous return, dehydration, reduced in cardiac output, and cerebral ischemia. Ischemia is just lack of oxygen. Okay, so we're going to see this most. I should probably just take out the heat part of this. Where I've seen this most is here in the valley is cross-country events. Some track, like on the distance events, but really the cross-country. So we have a really big cross-country area at Woodward Park here, where we host state high school championships, state community college, and occasionally state like NC2A. We've done before. NEIA for sure out at Woodward Park because we have a great course. It's a 5K or 10K course, multi-terrain, multi-surface. Everyone loves it, so you know. So if you ever done track, or if you never experienced cross-country, or if you never experienced a cross-country event, find one and check it out. It's kind of crazy and chaotic. So we're experiencing this is at the finish line. So these individuals are going to go from really high intensity exercise, Okay, so they're pretty much sprinting 5K. So it's like a little over 3 miles. And then once they cross the finish line, they stop. Okay, so all those major muscle groups go from all this movement to stopping all of a sudden. Well, all those major muscle groups, especially your lower body wise, when they contract, they're also helping pump blood. Okay, so all the blood that goes down to your lower extremities to help pump it up when they contract, back to your heart and so forth. So when you stop, that kind of assisted pumping of your muscles to pump that blood stops. So you get this pooling of all this blood in your lower extremities, which makes your blood pressure drop really quickly, and you get really dizzy, and sometimes you pass out. Not too often. A lot of times you'll get really lightheaded, and you kind of collapse. Okay, so this is where I experience this the most. Also, this is a kind of a form of shock. If you go back to the previous PowerPoint, that may be or may not be a test question on this, is all your blood vessels are vasodilated. Okay, so they're expanded out. Okay, so they have to vasoconstrict. Okay, to kind of keep your blood pressure up once you stop, and it's too quickly from going from that intense activity to nothing. So usually what you want to do with someone that just finishes a 5 or 10K race is, all right, once you cross the finish line, don't stop. Okay, it doesn't mean you have to keep running. Okay, they might do like a light jog or just like keep walking. Okay, we'll tell them all the time, just keep walking. For one, it clears the finish line, which is really important so you don't pile up and crash on one another. And two, makes sure that you avoid the syncope. Which syncope is just passing out. That's all it is. The definition of syncope is like just passing out. Okay, so signs and symptoms. Okay, dehydration, fatigue, tunnel vision, pale sweaty skin, decreased pulse rate, dizziness, lightheaded, fainting. Okay, treatment in the shade, monitor their vitals, elevate their legs above their head. Okay, again, that's a shock protocol. Get all of that blood in their lower extremities, okay, up to their head. Rehydrate them. They're going to recover usually in about 10 to 30 minutes, give or take, and everything will be fine. Next is heat exhaustion. Okay, so this is decently common here in the Valley. So this is the inability to continue exercising associated with any combination of heavy sweating, dehydration, sodium loss, energy depletion. This occurs most frequently in hot and humid conditions. Okay, so here in the Valley, we get really hot. We don't get really humid. Okay. Our humidity maybe gets to 30%, but usually not too much beyond that. Where on the East Coast, you're going to get the opposite. You're going to get somewhat hot. Like their highs are like 80, 85, give or take, but their humidity is like 85, 90%. Complete opposite. Okay, so heat exhaustion, okay, you just can't keep doing that continued exercise. Okay. All right, so signs and symptoms of heat exhaustion, okay, is normal to elevated body core temperature. Okay, it's like 97, 104. Dehydration, dizziness, lightheaded, syncope, which is passing out, headache, nausea, anorexia, diarrhea, decreased urine output, persistent muscle cramps, pallor, that's just like that paleness in your skin, profuse sweating, chills, cool, clammy skin, intestinal cramps, urge to defecate, weakness, and hyperventilation. They don't have to have all these symptoms, but you're going to have a good amount of them. The key thing here I want to emphasize is the core body temperature is less than 104 degrees. Treatment, okay, remove from activity, get them in a cool shaded area, take off their clothes. That lets them cool off a little bit quicker through evaporation. Cool fans, ice towels, ice bags, give them water. IV, maybe if needed in extreme cases. Cool shaded area, preferably indoors. Okay, or if you're out at like some remote area, can get them in a car, crank the AC, kind of a thing. They'll recover fairly well, no really issues. All right, heat stroke or exertional heat stroke. Okay, so when I talk about exertional heat stroke, so there's two different forms. This is more related to physical activity and being out, and the other one is more of falls more like the geriatric populations or the pediatrics, like someone left a hot baby in a car, or something like that's not related to exercise or activity. Where this one's related to strictly activity. Okay, they're roughly the same, but just know the difference between one's like related to activity and one's not. Okay, so this occurs when the temperature regulatory system is overwhelmed due to excessive endogenous heat production or inhibited heat loss in challenging environmental conditions. This can progress to total thermoregulatory system failure. Okay, so heat stroke is life-threatening. Okay, so this is essentially where your body says, screw it, I'm done. I'd rather just sacrifice organs to save myself. Okay, and if nothing really changes, then you can die. Okay, so the overheating of organ tissue that may induce malfunction of the temperature control center in the brain. Okay, so you can't control your temperature anymore, whether up or down. Okay, circulatory failure. Okay, so now your heart function is now compromised at some point. Severe lactic acidosis. Okay, so the accumulation of lactic acid in the blood. Hyperkalemia, okay, which is excessive potassium in the blood. Renal failure. Rhabdomyolysis, which is destruction of the skeletal muscles, usually associated with strenuous activity. Combination of all these, and death. Okay, so emphasize here is the core body temperature exceeds 104 degrees. Okay, really, really important. Okay, at 106 degrees, your brain starts to cook. Okay. Now this is your core body temperature exceeds 104 with you not doing activity more. Usually, like when you do activity, let's say we're outside, it's 105 degrees, and we're playing soccer, whatever it is, your core body temperature can get to roughly like 108. But as soon as you stop, it usually lowers just because your body can't change your temperature down to safe levels. Okay, so it's going to exceed 104 and it's going to stay that way. And there's nothing your body can do to cool it down. Okay, the first marker seen is a central nervous system change. Okay, really, really important. Okay, they're going to have this altered mental status that's going to be completely crazy. Okay, dizziness, drowsiness, irrational behavior. I've seen combative, like severely combative. Dangerous to themselves and others. I've seen hysterical. I've seen crazy. I've seen both like a minor mental status change and then major. Okay, it's a minor one. I was working cross country here at Woodward Park, and I picked up a girl off the course, given I follow every course in a golf cart or gators to pick up stragglers. I picked her up. She goes, I don't feel too good. I'm like, all right, well, it's hot. A lot of people not from the Valley are competing in this race. It's like from the Bay. Not competing, competing, and like, let's say people from the Bay come down and compete here, and their high is like 80, 85. So they come down here, and it's 90, 95, 100 degrees, which is pretty normal for us. They pretty much, it's the worst thing in the world for them. So, I mean, it's normal for some of them. So I picked her up. She was somewhere from the Bay. And she's like, I don't feel good. And then as she's talking to me, things are just getting kind of crazier and crazier. Not like a normal conversation. Like, for once, she keeps talking faster, and just her speed of talk is just crazy high. Okay? Next, some of the stories she's telling me doesn't make sense. Like, her parents are divorced, and her dad's sleeping with someone at the course right now, and I'm like, all right, so this is bizarre. So that was the first thing. Okay, so something's not right mentally. Okay. And then the treatment for her is, once we got her back and did a full eval and everything else, we threw her in an ice bath, which I'll talk about here in the next few slides. Her immediate response was, to an ice bath. And you guys ever take an ice bath, it's really cold. So, all right, so there's another one. So then she finally calmed down to the point where given she had to be hospitalized and everything like that. But that was a minor change in mental status. The major change I've seen was same event. I can't remember the same year, different year. I following the course in a golf cart, picking up people, and probably got like 4 people in the cart that are having whatever ankle sprains and heat illness symptoms and whatever. And we find a person like 100 meters from the finish line, and he's unconscious. I got flagged down by spectators. So pick him up, throw him in the cart really quickly, take off to the finish line where all like the medical area is, and he is super hot to the touch. Okay. And we start throwing ice towels on him because all our ice baths were full with other people with heat stroke. And he wakes up and he's super combative. Okay. Given he's probably, just to paint the picture, he's probably like 100, 110 pounds. Cross-country athlete, super skinny. Maybe, probably about 5'6". Okay. And he starts swinging. And then he starts threatening people. And obviously, like, it's one of those like obvious heat stroke issues, super combative. So then we keep trying to cool him down best we can with like ice towels, just kind of waiting for the ice bath to kind of open up. EMS on site won't even approach because the protocol is we're not going to approach anyone that's combative. Okay, their kind of protocols are going to wait for police to detain before we kind of like engage, which is them. So they're kind of just off to the side, just kind of like monitoring, kind of waiting for us to kind of bring them in. And this kid is just super like off the wall. We're trying to do everything we can. His coach, his parents are there. I'm probably the smallest person there at like 6'2", 240 at the time. And I'm the smallest person there holding him down, and we are losing the battle against this kid. Okay, because he's so strong for whatever reason. And then some poor nurse, I feel so bad for her. It was like selling like t-shirts or working snack bar or whatever it was, and comes over, like, because sees we're obviously like losing this battle with this kid. He goes, "Hey, I'm a trauma nurse. Can I come help you?" And he like stops and looks at her, and it's like a bull seeing red. And he threatened to murder her, her family, the dog, everyone else. And she's like, "All right, I'm done." And the poor lady, to the goodness of her heart, came over to offer her help. And then at some point, shortly afterwards, he throws up everything in him. And then he finally calms down enough. Ice bath opens up. We throw him in the ice bath. We do everything associated with that. And he gets hospitalized shortly afterwards, kind of a thing. Okay, so that's more of a major mental status change. Other things you see, obviously dizziness, drowsiness, irrational behavior, obviously. Confusion, irritability, emotional instability, hysteria, apathy, aggressiveness, delirium, disorientation, staggering, seizures, loss of consciousness, coma. Okay. There would be dehydrated. There have weakness, hot and wet or dry skin. Okay, so one of the early myths of heat stroke is characterized by only hot, dry skin. Okay, so that is now proven differently. With exertional heat stroke, they're going to have wet skin. With more than normal heat stroke to, like, let's say, infant in the car or elderly person like falls and like stuck like in the backyard in the heat, they're usually going to have like a dry skin. Okay, but with someone with exertional heat stroke, they're going to have wet skin. Hot wet skin. Excuse me. Okay, they'll usually be tachycardic, which is the heart rate exceeds 100 beats per minute. Hypotensive, okay, so low blood pressure. There could be hyperventilating, vomiting, diarrhea. So all of these are very, very bad symptoms, obviously, with heat stroke. Okay, treatment, remove from activity. Shaded area, really you got to do a submersion pool. Okay, you do have to monitor vitals. You have to lower their core body temperature as quickly as possible. Okay, so the submersion pool, the ice bath, if you will, is to be roughly as close to 35 degrees as you can. Okay, I mean, if it's up as close to 60, still great. Okay, but the colder the better. Okay, usually ice baths should be between like 50 and 60 degrees. Okay, so this one I'm going to want 35 degrees. Okay, so really, really cold. Okay, I'll talk about cardiac shock here in a minute. Okay, obviously EMS. So heat stroke is the only medical condition to where I will actually delay EMS from taking them until I get their core body temperature to 102 degrees. Okay, very, very important. Okay, so if I don't quite get to the 102 degrees, as soon as we take them out of the ice bath, their body temperature will go right back up again. If I leave them and it gets lower than 102 degrees, what happens is because their temperature control center of the brain is now gone, their temperature is going to keep going down. Okay, because they can't warm themselves back up again. Okay, that's also very, very important. Okay, and obviously with treatment, it will be a 911 no matter what. Okay, they're not like, oh, I'm going to go home and recover. No, they need to go get checked out first because usually they're going to have damaged organs. They're like fried. Their muscles could be damaged. They could have brain damage to some extent. Okay, so the protocol for ice water immersion. Okay, ice tub should be added. Ice should be added to the tub as soon as heat stroke is suspected or kept at that temperature. Okay, which can take a lot of ice at times, depending on the bath. So, like when we're out at Woodward Park, we'll actually have like a horse trough, like a plastic trough. Works perfect for these situations. They're fairly cheap. They're like $80 to $100. They're lightweight. They can store amount of water as much as we need, and we just add ice. Okay, so we'll try and keep them usually during this event roughly as close to 35 as possible. So usually it's standing ice at all times. Okay, we do want to insert a rectal thermometer. Okay, probe to take the reading. So this rectal thermometer, sorry for the slight pause, I happen to have one. Okay, so this one is not like the normal one that you would think about when you're taking the sublingual under the tongue. Okay, so this one is just this big. That's all it is. And then the cord for it, okay, is this. Okay, so it's a cord. It's really, really small. To put it in perspective, okay, here's a pen. Okay, and that's how small it is. So this is a very, very obviously long cord. Longer the better. So it is going back to this. So as soon as this heat stroke is suspected, you want to insert this. Okay, usually the right state of mind. Most often than not, they're unconscious by the time you actually find this person. Okay, so you put them in the recovery position, which is on the side. You bend one knee up. Okay, you pull the pants down a little bit. Obviously, you have something kind of draped over them. That way, no one else can see. You lubricate this. Okay, there's really, really strict sanitizing protocols for this. Obviously, you start it up to 15 centimeters. Okay, you don't feel anything. This is very, very, very much a common medical practice. A lot of people gross up beyond this. Okay, this is totally normal, and this is very, very important to save your life. Okay, so we're going to stick this up there. You're going to take the reading. Okay, they're going to insert them in the ice bath with this still in them. Okay, very, very important. And once they're in the ice bath, okay, obviously it's in there. Once they're in there, you want to stir the water continuously. Okay, the entire time. I will also take a towel and I'll put it over their head. Also, I'll dump the towel in water, put it over their head. That way helps cool off their head a little bit. Have someone stir the water, obviously, the entire time. Then once the rectal temp reaches 102 degrees, we will pull them out. Okay? And then this is where EMS, if they have not approached you already. So once they get in the tub, okay, we'll get EMS over if they're not already there, given the combative nature of the person. And then we'll take vitals, we'll do everything, try and get history, the whole shebang. And then once they come out of the tub, then EMS takes them. Okay, there's not really like a say-so in the matter. If possible, they're just going to take them to wherever they deem, facility they deem appropriate. Okay. So cardiogenic shock. Okay, so this is always a discussion of you're going to put someone that's super, super hot in a really, really cold water. Okay, everyone's like, oh, it's cardiac shock, you're going to shock the heart, you're going to kill them. Okay, there has been 0 fatality rates in heat stroke patients with cold water immersion. Okay, that is cold water immersion. Cold water immersion is the single best way to save their life. Okay, and then once you have the heat stroke, you're more prone to it. That's just how it is. You're just more prone to it. So, like the individual that was combative, that the story I told earlier, obviously after the fact, I was doing a kind of follow up with his coach, and he had had heat stroke the previous year. Okay, so it was just really easy for him. More about rectal temp case. So the core body rectal temp, the one I showed you here, is the most accurate way. The oral, okay, under the tongue, the forehead, the ear, the armpit, is not accurate by up to 10 degrees. So that is a tremendous difference. And one of the studies by this mad professor I mentioned earlier, he did data with this, and that the core body temperature with the rectal temp was more accurate. Did the same thing with under the tongue, and that was off by 10 degrees. Just because like the distance and ability to cool it off, because there's like less items up here and so forth. There's another way other than rectal temp. It is actually a pill. It is a thermometer that you ingest. Okay, you have to do it ahead of time because it has to get down there for certain ways. I think it takes like 10 minutes for it to get in the adequate spot to take the temperature, and then you have to wave. It's like a wand or something by the stomach to get the reading. But that is really, really expensive to do, and you usually have to give it like to everyone ahead of time, and then somehow you have to get that thing afterwards, or it just gets obviously just defecated and tossed. All right, Nick. Next is heat acclimatization. Acclimatization. Excuse me. So this is just getting used to the heat. Okay, so it's starting to heat up. Obviously, as I'm making this PowerPoint, it is 107 degrees is the high today. So usually for athletic competitions, the first athletic period, the first 14 days of that preseason practice is solely for heat tolerance. Okay, to kind of build up that tolerance. Realistically, it takes about a month, but the first 14 days is the most critical. Okay, so this is the first 14 days is the most the higher chance of getting heat stroke and heat exhaustion. Okay, during those days, as you're trying to get used to it. Football has the highest chance during this just because they have the pads, and so usually it's a slow progression into pads that they have to do, where the first few days is like no helmet, and then you add the helmet, and then you have shoulder pads shortly after that, after so many days, and then after like 2 weeks, then you can actually get into full pads in full practice. Now, being properly acclimatized to the heat enhances your physiological function, your heat tolerance, your exercise performance. You even actually gain blood. You actually produce more blood. So I think it's up to like a liter more blood than you would usually have. You start sweating earlier, and your body becomes more efficient at dealing with heat. Okay, hydration guidelines. Okay, so the American Academy of Sports Medicine recommendations: 16 ounces 2 hours before exercise, 16 ounces 15 minutes before exercise, and then during exercise, which is every like 15, 20 minutes, another about 16 ounces. Okay, so I mean, this is kind of strict, and so usually most practices, so every like 15, 20 minutes of like practice, you should get some kind of like water break, hopefully. But just drink often and regular. Long story short, after exercise, you can drink roughly 24 ounces for every pound lost. Okay, and you have about 6 ounces to replenish all that body weight. I've seen as much as 11 pounds of body weight loss during a practice. It was football. It was a big lineman, but he lost 11 pounds during a 2-hour practice, which is a lot. Given he was a big guy, he was like 300 pounds, but still that's a good amount. So what's important to do during this, as I can't remember if I talk about this a bit later on or not, but you do weigh-ins and weigh-outs, especially during this time. So what happens is, or what you do, before you like go do exercise, you weigh yourself. Okay, the number doesn't matter. Like, don't think about it as, oh, I'm losing or gaining weight, but you need to do that number. Say you weigh in, let's say before practice at 200 pounds. Okay, and then after practice you weigh out again and try to do both the weigh-ins and weigh-outs with as least close as possible. Okay, so usually like in your underwear or whatever it is best. Usually you do this like in the locker room, or at the training room or wherever it is. And then you weigh out and you see the change in your weight. And that's all body weight. You can't burn 3 pounds of fat in one practice. Not possible. Okay, so you weigh in and you weigh out. Okay, and then however much you lost, let's say you lost 5 pounds during practice. Okay, so I needed 24 times 5. What is it, like 128, 130 ounces, however much that is. I need to drink that much weight back up again within 6 hours. Okay, that way when I weigh in the next day, when I weigh in again, I should be at that 200 mark again. Okay, so this is good, especially during the first 14 days, give or take. When I was at high school, we would do this roughly the first month. Okay, especially during those hot times, to kind of like train all the athletes to kind of know like what they should be at. Okay, so things that we would experience is let's say Monday, individual weighed in at 200 pounds. Okay, he weighed out at 195. Okay, Tuesday he weighs in at 196. Okay, he weighs out at 192. Wednesday he weighs in at 195. He weighs out at 189. Okay, Thursday he weighs in at 190, and then he weighs out at 185. So now he's lost, what is that, 15 pounds of body weight, of fluid. Okay, so that's very, very dangerous. Okay, so that's the purpose of this. And so by like Thursday, Friday, we'll actually pull him from participation if he still doesn't get it up again, until he recovers that body weight or those fluids. Okay, very, very important. And it's usually really easy for a lot of these athletes to drink that much water. But staying atop them, make sure they recover that amount. And I wouldn't drink that, whatever, 150 ounces all at once. Okay, it might take those 6 hours to do it. Okay, a little at a time, every hour, every half hour, kind of recover all that. Whether it's water or sports drinks, either one works. All right, what to drink? Okay, water's great. Quickly absorbed, well tolerated, excellent thirst quencher. It's pretty much free. Okay, sports drink. This is your Powerade, your Gatorades, anything like that. Okay, has a carb and sodium mixture. Okay, if the carbohydrates, okay, the CHO, is greater than, what is it, 8%, it slows your gastric emptying, which makes you feel bloated. Okay, which also takes away all that blood from all that blood you need to your muscles and puts it more towards your core for digestion, obviously, because all those carbs is calories. Okay, so your performance can decline. Okay, sports drinks are really good if exercise exceeds 45 minutes. Intense activity with risk of heat injury or illness. Extreme hot and humid conditions. Really good for any kind of sports drink. Okay. Sports drinks are also appropriate for individuals poorly hydrated prior to activity, have increased sweat rates, poor caloric intake prior to activity, and are poorly acclimatized to the heat and humidity. Okay. What not to drink? Okay. Fruit juices, which often exceed 8% carbs, soda, some kind of caffeine, alcohol, carbonation thing, which all these contribute to polyuria, which is excessive urination, which can obviously dehydrate you. Okay. Supplements, okay, can increase risk of heat illness and heart illness, not regulated by FDA. Okay, purity, not guaranteed. So they can pretty much put whatever they want on the label. Okay, whatever the supplement that is. Okay, so be very, very careful. And you should probably not take anything because, like when you're doing like activity, you don't really need anything honestly if you have a good balanced diet. And a lot of these items are banned by NCAA and the Olympic Committee, as well as any other place. So this is where I kind of tie into sports drinks because here in the Valley, we have energy drinks everywhere on every campus. I don't know if they take them all off yet. But we try to get them like not allowed on campus, especially by like locker rooms and so forth. So in 2006, there were over 500 brands of energy drinks. A lot of these athletes will take these all day long in the morning and so forth. A lot of time we'll take prescription drugs, okay, over-the-counter prescriptions. Should not be taken because it increases their potency by a lot. Okay, what is in energy drinks? Okay, obviously carbs usually exceed 8%. Caffeine. So a normal cup of caffeine is about 85 milligrams. Okay, and a lot of these can exceed about 3 cups of caffeine in like one dose of energy drink. A lot of herbs, okay, which is the caffeine, and a lot of the normal like natural stuff, which still gives you that caffeine thing. A lot of performance enhancement items. Most of this I can't even say, which are not really like bad for you, but really bad if you're trying to do anything that like drug tests, or maybe bad for your heart and so forth during activity in extreme conditions and intensities. Okay, here's a little thing on sugar and caffeine energy drinks. Okay, and this is like the dosage. So like Rockstar Endurance, 500 milliliters. Okay, 69 grams of sugar, 160 milligrams caffeine, okay, and so forth. And this is just a few. I wish I had more out there, but I'll just give you a lot. Okay, you can see kind of what's in them. Negative effects of energy drinks. Okay, central nervous system is obviously affected with the excessive caffeine production. You get lightheadedness, you get tremors, impaired sleeping, difficulty with fine motor control. With enough caffeine in your system, you can actually fail a drug test because you exceed the limit or the threshold. Your GI system is thrown off. Okay, so obviously you get that bloated feeling, abdominal cramps, diarrhea as a result. Dehydration. Some energy drinks actually advertise hydration. No, because obviously it is a polyuretic? No, a diuretic, excuse me. Okay, so it makes you pee more often. Obviously, positive drug testing. And the biggest thing in adolescents and young adults is linked to heart attacks with arrhythmias and liver problems. And this is not really just energy drinks. Pre-workout's another big one out there that a lot of athletes take. I talked to one athlete, and he would take 2 scoops of pre-workout first thing in the morning to start his day. And then caffeine and then energy drinks throughout the day. And so, I mean, you're just asking for more issues down the line. And that is it with heat illness. And then here are obviously some references.